The MISTRAL-AIR forced air warming system enables simple, safe, and efficient management of patient temperature. MISTRAL-AIR's low-profile design allows it to be mounted onto a variety of surfaces such as walls, stretchers, beds, IV poles, and stands. The new MISTRAL-AIR stand has a molded plastic base and a telescoping pole that can be raised to increase the height of the stand. The MISTRAL-AIR High-Efficiency Particulate Air Filter, or HEPA filter, is proven as 99.99% effective in capturing what is considered to be the most difficult particle size to catch, 0.3 microns. The MISTRAL-AIR HEPA filter surpasses the level of filtration required for use in specialized patient care environments, such as operating rooms, critical intensive care units, and airborne isolation units. After 2,000 hours of use, the MISTRAL-AIR HEPA filter alarm will sound to notify you that a new filter is needed. The MISTRAL-AIR has a quiet, high-volume blower. Diffusion technology eliminates individual high-pressure jets of air that can cause the blanket to loft. Therefore, the blanket stays in position, which keeps warm air on the patient and helps to minimize the disruption of airflow in the surrounding environment. Note: you do not need to place a cotton blanket on top of the warming blanket. Approximately 90% of patients' temperature loss during surgery occurs from the skin into the environment through radiation, convection, and evaporation. Thus, minimizing heat loss during the perioperative period is a priority. Reflective technology can reduce heat loss by up to 80% in the perioperative environment. The ability to both actively and passively warm ensures that patients continue to maintain heat during periods of transfer when the patient is not connected to a blower unit. Note: hypothermia can occur in all phases of the surgical period. The MISTRAL-AIR warming system is a forced air warming device comprised of a warming unit and a variety of blankets. It is intended to raise and maintain patient temperature by means of surface warming. MISTRAL-AIR blankets are available in numerous configurations for patient and position-specific warming. A broad range of standard and premium warming blankets facilitates use in a wide variety of clinical settings. If available, a full-body reflective blanket is applied to the patient in pre-op for pre-warming. More than likely, you will have a lower body warming blanket. The pre-op patient should be educated on the importance of pre-warming and pre-warmed as long as possible. The reflective blanket will be connected to the MISTRAL-AIR unit to provide active warming for the patient. The pre-op full-body blanket or lower body blanket should be left on the patient until the patient is moved to the OR table and positioning and/or prepping of the patient begins. This will prevent radiant heat loss from the patient. Do not use cotton blankets under or over the reflective blanket. The reflective blanket will be able to passively as well as actively warm the patient without the use of cotton blankets. This is the underbody warming blanket. Caution should be taken when tucking the blanket to prevent obstruction of warm airflow throughout the blanket. Make sure you remove any cloth blanket next to the patient's skin and place the reflective blanket directly on the patient's skin for optimal insulation of the patient's radiant heat. The upper and lower body reflective blanket should be placed on the patient as quickly as possible to reduce heat loss when pre-op reflective blankets are removed. The upper and lower reflective blankets will work passively when the MISTRAL-AIR unit is not connected. The blankets will work actively when the unit is connected and turned on. Again, do not use cotton blankets over the reflective blanket. The reflective blanket will be able to passively as well as actively warm the patient without the use of cotton blankets. Note: the default startup temperature is 38 degrees Celsius. The pre-op reflective blanket should be applied to the patient when they are transferred back to the stretcher and on the way to PACU. Remember, the reflective blanket can be used passively by itself when the MISTRAL-AIR unit is not connected. Actively warm the patient with the MISTRAL-AIR unit upon their arrival to PACU to maintain the patient in a normal thermic state. Remove the reflective blanket if the patient is febrile. Monitor the patient closely for temperature changes. If the patient becomes hypothermic, reapply the reflective blanket.
Can you do it slower?
Okay. Do you want me to start it over?
This is our, we're going to harvest your organs while you're in there and you're never even know it.
Shoot.
You know we do that all the time, right?
Leave me something good.
Okay, we'll leave you your heart. That's always good.
Leave me a heart and a love.
And just, okay, all right.
Yeah.
Well, a kidney too, because dialysis is pain.
Yeah.